Thank you. So in the next maybe 30, 40 minutes maximum, we'll talk about intelligent integrated hospitals. So briefly, many of you probably don't even know who Schneider Electric is. So just one moment, it's a large 180,000 person French multinational engineering, where we're in 106 countries, and one of our 7 strategic verticals is hospitals. So out of the 25 billion euros that we do a year, we invest 5% in R&D, and a certain percentage of that is on innovation in hospitals, and in particular, how we can build more intelligent, integrated hospitals that improve efficiency, improve patient safety and quality, and improve the patient experience. Okay, so that's what I'm going to be talking to you about in the next few minutes. But let's start with Finland. And in particular, the challenges that are facing Finland, as we even heard from our previous speakers, are pretty much the same in the developed world. You know, we at Schneider Electric are building hospitals not only in the Nordic countries, Western Europe, US, Australia, but also quite a few hospitals in the Middle East, China, India, Latin America. But similar problems and challenges that we see in Western Europe, US, Australia, and I would say even Singapore, are facing these budget challenges. How to bend the cost curve before the cost of health becomes so much a big part of GDP that is no longer really affordable. So in order to do that, it's requiring a new way of building hospitals, a new way, new processes to increase efficiency. So reading through the Finland documents, okay, translating, I can't speak Finnish, but translating using Google Translator, and plus my colleagues, we have a dedicated team here for healthcare just in Finland, and talking about how we can increase the productivity as the costs go up to try to bend that curve by negative 2.4%, and instead of hiring 3,000 more people per year in the healthcare system in Finland, how can we do it with 1,000 similar ways that per year? And the key way to do that is to have collaborative, multidisciplinary workflows, but also to have effective integrated healthcare IT systems. Now, the previous speaker was talking about where there's been huge progress over the past 5 years, I would say, in particular in the Nordics, Australia, UK, US, and healthcare IT, in moving the messages, eliminating paperwork on core clinical processes. And where we, as Schneider Electric, see another frontier of efficiency is by looking at the intelligent integrated hospital itself as we build new hospitals to replace the old ones and to put in new processes in the new hospitals. So how can we make that an intelligent digital platform that can eliminate waste and improve productivity, as well as improve patient quality and safety? These are the trends that we see almost everywhere in the world as they're trying to build these new digital hospitals. Why are they doing digital hospitals? This idea of digitization. And first, it's to bend the cost curve. One way is through staff productivity, to try to make processes more lean. You can see Lean Six Sigma, which are processes that people are measuring and trying to take waste out of the process, but also using new technologies like real-time location systems to get data to measure the efficiencies there, to get better asset utilization. So we have a certain amount of medical equipment in our hospitals that isn't used all the time, and that could be used more effectively if it was shared more efficiently. To improve energy efficiency and contribute to green is another goal of new hospital construction. And then to try to improve service levels, improve patient safety and quality. Why is it that in the year 2015, that in a technologically advanced, well-funded new hospital, the percentages of people that can be harmed in a new hospital is still 1 in 10? What can be done to systematically reduce that so we approach more like the aircraft industry, where your chances are 1 in a million, and try to improve patient satisfaction and the patient experience? So to do that, we're going to talk to you about a case study normally, and when we're doing a lot of work with different hospitals in the Nordic, always looking at the other Nordic countries. But in this case, I'm going to bring you an example from a very far part of the world. In this case, it's Australia, where they just went through 10 years of new hospital construction, similar to where Finland is now. Denmark is in the middle of it. Right now, similar types of thing. The UK also went through about 10 years. And this particular hospital, what's really advanced here is, over the past 5 to 10 years, you've seen hospitals move to so-called integrated hospitals, basically integrating building systems and making them more efficient at that level. At this hospital, they've added the IT layer and added messaging systems on top of an intelligent digital hospital too. So we think that this is really quite innovative and is where really the state of the art is going. So this is almost €1 billion project, 900 million euro project, expensive for the Australian health system. It's a tertiary children's hospital serving the highest level for the whole part of Western Australia. Children's hospital. You can see they have 12 operating theaters, 4,000 rooms, almost 300 beds. Their vision was to build a world-class hospital that they wanted to benchmark not only against Australian hospitals, but worldwide. They wanted it to be green. In Australia, they use the term Green Star, which could be like lean, which could be like BREEAM. Every country has its own standards for green energy efficiency, but also to support the new way that healthcare systems need to work to be more efficient, which is healthcare without walls, based on healthcare IT technology, multidisciplinary workflows, and to develop clinical and business systems that maximize efficiency, quality, safety. That's what their vision was of what they'd like to do with this new hospital. So at first some technical stuff, and then to bring it down to specific use cases, which you probably can't even see this, okay? But the way hospitals are built today, let's say here in northern Finland, you're gonna construct a brand new hospital. They are done traditional way still, which means they find a contractor, they go out to bid, they need a lighting system, they need electrical systems, they need building management, and all these systems are on separate islands, not connected to anything. That's the traditional way. It's no different than an office building or a hotel. It's not an intelligent building, okay? And what this is doing is, what Schneider Electric does is what's in green, which you can't read, okay, but that's too small. But essentially, it's everything from electrical systems, building management systems, security systems, fire systems, but also integrating nurse call systems, wayfinding systems, connecting to the admission discharge transfer system using HL7 connections, connecting to the whole healthcare IT so that the workflows of the hospital are connected to an intelligent building. And I'm going to give you real examples in a minute so you can see what the value is of this. And to do that, what's new is that not only was it in traditional hospitals or all these different systems sitting on islands, and in fairly newer hospitals connected with building management systems, but in this new one, it's connected directly to healthcare IT, which will bring messaging to the right person at the right time to help improve efficiency, patient safety, patient satisfaction, and bringing that messaging to where the healthcare providers are, which is either on their tablet, on their smartphone, on their boards, intelligent boards, or wherever the information needs to be at the right time. The core of the intelligent infrastructure is based on IT systems, building management systems, and security systems that intelligently link patient monitoring, real-time location systems, nurse call systems, medical imaging, kiosks, digital messaging, all of these systems connected as a base infrastructure, but then connected seamlessly through IT to bring the right information to the right person, so it brings it onto dashboards, to tablets, to smartphones, and intelligent processes. So let's talk about specifics of what this means. What is a smart hospital? What is a digital hospital? And why is it different? With some specific examples. First, it's once again, in order to bring all these systems together, it's brought together on an enterprise service bus, which brings all the information and allows all these different systems. A typical hospital might have 50 different software systems, about 20 different networks, and it's a bunch of islands. So you need an enterprise service bus that brings all the information together in order to implement that. If you don't design a hospital this way, then you'll always end up with islands. You'll never be able to bring the information together later, or it'll cost you a lot of money to do it. But if you do it up front, for the same construction costs, you can do it in a more intelligent way. And on top of connecting these systems together, you need to put some more intelligent IT systems to not only connect them together with an enterprise service bus, but to have business process management, IT rules on the workflows, a common look and feel so that you don't think you're working with 50 different systems. What comes on your tablet or your smartphone all looks the same, even though, just bringing the information together, integrated then with the hospital's core workflow and software systems. So let's look at some examples of what intelligent hospitals can do, starting with an emergency, right? A code blue. Now, keep in mind, before you say on any of these workflows, they're not fixed. These are open, flexible systems that have been tested, validated, documented, and then as a toolbox are applied to your hospital, your vision, your workflows, and so they're adaptable. This is Perth Children's Hospital's workflow and how they wanted to do things. So it's mapped around what they want to do. Code blue, patient presses the emergency call button. Is it a code blue? Nurse goes to check. The nurse first gets it on their mobile device, similar to what we heard in previous presentations, right? That rather than standard nurse call, you now have it in your mobile device. Nurse goes to check. Yes, this is code blue. Immediately, the message is sent automatically across a large hospital to the code blue teams, the emergency teams who come running with what they need. But at the same time, when people are under stress, they can't think. They're so focused on what they have to do, and that's when errors occur, right? So when you automate some things, you can eliminate errors, and it remembers to automatically make the message on the public address system, and then shows that clinical team exactly where the nearest emergency cart can be found, so they're not spending those extra seconds or minutes looking for it, and they go in to help the patient. Okay, that's a clinical example. More of infant abduction. So this is a children's hospital. Okay, infant abductions are, as you know, rare, but when they do occur, they make national and then international news. It's a big impact on staff, but also on the reputation of that hospital. So here's another example of intelligent integration. So in an infant, you know, the typical infant abductor will pose as a government worker, or they'll say, I just need to weigh the baby. And then they typically go out, you know, the fire escape with the infant. And so how can we use all the technology that's in the hospital anyways to help prevent that? So in this case, they use infant bracelets. We work with Stanley Healthcare, which is the leader of Hugs, which makes infant bracelets that go here on the navel. And that needs to match the mother or the nurse. If they don't, it immediately sets off an alarm. The access control temporarily will lock the fire escape. It will flash the nurse call and a special code. Some hospitals use code pink, you know, to show that there's been an infant abduction. It will make an announcement with the paging system. It enables the security staff to create a perimeter around the entire property to make sure no one leaves or enters that property. The video zooms and takes pictures of who might be taking that infant and displays it for the emergency staff to take action. Now, inside a new hospital, all this stuff exists anyway, but it's sitting idle. There's not intelligent use cases to make it work for you in an intelligent way, in this case, to prevent an adverse event, which is an infant abduction. Another example is a fire. So in this case, code red fire. There's a fire somewhere. Someone has either pressed the button or a fire alarm has gone off. First thing is, access control to make sure whether people are available, open doors, closed doors. HVAC to shut off the air conditioning to make sure it's not blowing on that hospital. Lighting, make it bright so you can see with the video cameras, is there real fire or not? And to integrate this then with messaging systems so that the ward, for that ward, can verify, is it a real fire or not? Am I going to evacuate for no reason at all and cause a big disruption for nothing? Or yes, send the alarm and the work flows to the entire system. Another example of intelligent integration, using systems that even in a building like this you have but aren't connected together in an intelligent way. And in a hospital where it could help save lives, but also improve efficiency if people are evacuated for no reason. In Western Europe, on average, hospitals are about at 70% capacity. In the United States, they're about 65% capacity. But at any one time, they're at 100%. They're sometimes 50%, but you do have those peak times where there just isn't enough room. And when that occurs, you have people waiting in the hallway. Now, this is, first of all, a patient safety event. If you look at all of the adverse events that lead to death or permanent loss of function, delay in treatment is in the top 10. And there's a risk that, this person here, and there's nobody with that patient that seems that they just forgot about. 10 minutes, 20 minutes, 30 minutes, people are so busy they forgot about them. And not only that, but it's a patient satisfaction issue. You know that this lady with her mother is not very happy that she's been waiting there 20 minutes in the hallway and there's no room, and why can't someone care for my mother? So there's patient satisfaction, patient safety, and it's also efficiency. It's efficiency of how to quickly increase the throughput through the room. So what this is once again intelligent integration. All the information is there, just how do we use it in an intelligent way? We use real-time location systems. Okay, this is really on the leading edge of real-time location systems. The first place where they're being used is to track assets. It's easy, very efficient, and I'll show you that one in a minute. But some hospitals are moving to this and putting these real-time location systems on the patient bracelet. So now you know where the patient is at any time. You can see the flow through the hospital. You can improve efficiencies. But in this case, for this particular use case, that little tag will send a message every 10 minutes. Or whatever you program it, every 5, 10, 15. Still waiting, same position. And link it directly to the mobile device, a tablet or smartphone that is connected to the admission discharge transfer system, where you can see in simple dashboards. This is a Schneider Electric dashboard that we created with the Center for Healthcare Innovation in Australia, where we test these things with clinical staff, and where they really like this format in simple ways. Okay, but we can use whatever format that the hospital is using to bring the right information to the right person to the right time in a simple way. Show them when the room is available and get them into the room. Remind them, get them into the room. Operating theater. It's a critical area. Surgeons and the nursing staff need to be focused on patients and be focused on what they're doing and not be distracted by things that can happen in the middle of an operation. And some of the things that happen is there could be power failure, rare, but can be catastrophic, okay, when people have to move to flashlights. And to do simple things like changing airflow, temperature, depending on the surgeon's preference, and to know that things are taken care of so you can focus on finishing that operation. So what we have here is a display, simple display that goes into the operating theater that replaces about 5 different devices that are normally there. And to give that information to the nursing and clinical staff in a simple way that merely tells you what's going on with the electrical system. There's been a power failure in my operating theater. I'm on backup. How much time do I have left? In this case, it says 108 minutes before the lights are going out. Okay, so you don't have to worry about that. To have your facility staff automatically notified, so they're working on it, so they don't have to think about it. They don't have to make the telephone call, so that the surgeon and the maintenance can take care of that, and the nursing station automatically knows what's going on in that power failure. But at the same time, the same system is used for other things to change what is the status of medical gases, what is the temperature, what is the pressure, what is the humidity, and enabling the staff to easily change that with a touch screen. Expedite room turnover. So this is a new child's room in the Perth Children's Hospital, and the new style to make kids feel comfortable and make it seem more like not as threatening, not as stressful. But in the background, what those kids don't even realize is they're trying to, at the same time, improve efficiency in the background while focusing on patient care. So this patient is discharged now from the hospital. Okay, so the ADT system notifies that there's been a discharge, updates the system. The bed management system, so it's a matter of connecting different systems, intelligent integration. The bed management system's alerted to set it to awaiting cleaning. Housekeeping receives the request. Bed management system receives the cleaning completed alert. The room ADT is set to available. So it's connecting systems faster in real time, in this case to improve room turnover, which could reduce the average length of stay. Not by full days, moving from, say, 4.2, as they were saying, down to 3, but just a few hours over the course of a year can make a difference. Assets. The average assets, and I'm talking about medical assets and equipment, such as infusion pump, it's a very common, that are throughout the hospital, are typically overbought by 2 to 3 times. And that's because when you need to do a test and when you need a piece of equipment, you have to go look for it. And there's been studies by the American Healthcare Association on nurses in the US, which maybe they are not so efficient compared to what we are here in Finland, but showing that they spend up to 30% of their time looking for medical equipment on some shifts, calling, walking up and down hallways, right? And not a very good use of time. But what's most inefficient is that because of that pain and waste of time, hospitals will then buy more equipment than maybe is what fully is necessary or seems necessary. So you don't seem like you have shortages and wasting time looking for stuff. But if you look at the asset utilization, how much time that's actually being used, it's quite low because it's not shared efficiently. So this is the first use case for real-time location system integration, and I would say the easiest one to adopt. Okay, as we start moving into staff and patient communication systems, which is where it's going, it's a longer adoption curve, I would say. But this one's easy because it's a straight payback within 1 year, right? You're looking for an infusion pump. I need one, and I don't see one around here. Now you just use your mobile tablet or smartphone, and it shows you not where all of them are in the whole hospital, but the nearest one to you that's available. And so rather than calling around and walking up and down hallways, now you go for that one. You can see the ones that are closest to you. You take it, it's now in use. The inventories are automatically updated. That is a way to improve asset utilization by a factor of 2, so that you only need half as much equipment on average. And this has been proven with empirical data in hundreds of hospitals all across Europe, US, Australia over the past couple of years. So this is clear. The expected savings, 300-bed hospital, is about 500,000, little under 500,000 euros a year. Besides improving workflows, trying to improve patient safety and the patient experience, a digital hospital can also be green, using the same integrated systems to improve that. So in this particular hospital in Perth, they were able to save 45% compared to peer hospitals on their emissions of CO2. And they were able to do that and also have significant savings in water. It's probably not as much of an issue in Finland, but in Australia, water conservation is important because it can be quite dry. But they were able to do it with intelligent building analytics and intelligent integration of hospital systems. And there's over 500 different use cases that Schneider Electric employs, or 350, 500 that we know, and 324 that were used in this particular hospital to try to make the hospital more efficient over time with intelligent integration. And that's not just when it was built, but as it's being operated. And so I will show you just one so-called use case to give you an idea of what this means. Or two of them, I'll show you two. In a typical hospital, we said it's 70% full in Western Europe, 65% US, roughly these numbers. Your hospital is different, probably varies from 60 to 85%. It means that somewhere between 15% and 50% of those rooms are empty at any one time. And we are running the HVAC, changing the air twice an hour with the lights on, wasting energy for no reason. Now, if we could change the flows that we would shut the door if there's nobody in the room, then we can shut that off. Now, what we don't want is something stupid and, the lights come on when you walk in the room, like a simple thing like you might have in a house or something like that. Won't work for a hospital. You can't do that. But what you can do is you can connect it to the admission discharge transfer system and in the core of the e-health system for the hospital, and then you have something reliable. So when a patient is coming in now, either through the emergency room and pending admission in room 305, let's say, then and only then do we turn on the HVAC and lights. Because we know that patient is going to come into that room within the next anywhere between 5 to 20 minutes, depending on how long they take to get up into the room. And by that time, the HVAC and lighting is fully operational. You would have thought it was on all day, but it wasn't. And as soon as that patient is discharged or being transferred to do some tests, it's shut off. And the nursing staff doesn't have to think about it because it's just the ADT system. There's something that's updated on the eHealth system that says now they're going to be discharged. The message comes through HL7, through the building management system, through the lighting control system, turn things on, turn things off, without any thought, without wasting anything, but saving energy, making a more green hospital. Another area is operating theater. Operating theater is in most places in the world is changing the air 30 times an hour. In some places they'll go even more, 40. That's a lot of HVAC that's cranking all the time. And some surgeons, they like to have, depending on what it is, it's really important. Certain humidity levels, it could be orthopedic or certain glues, or it could be temperatures sometimes go down to like 16, 17 degrees. But is it necessary at 3 a.m.? If you have 10 operating theaters that they're all running at 16 degrees C, 30 air changes an hour, and they're empty. So what this is using intelligent setbacks. You leave one going or two, depending on the strategy of the hospital, all the time for emergencies. But the rest you can set back to 6 times an hour. The patient room is 2 air changes per hour. Operating theater can be 6 and ramped quickly back up to 30 as the capacity comes, saving 7,500 euros per operating theater times 10, and it's just pure waste. That is cost savings, but also hitting green targets and building a greener hospital. So how do you build a digital hospital? And why is it that many hospitals end up not being intelligent hospitals and you end up with the same old building, kind of like this hotel room or a building, which is, not terrible. It's a nice hotel. I'm not criticizing that, but it's not built on the standards of when you want to try to improve all the things that need to be improved to get the kind of savings that are necessary, right? With the new health systems, we need to find 6% savings in terms of productivity and other types of savings. So where are we going to find that, and how are we going to build them in a different way? So first, in this particular hospital in Perth, it starts with building information management system. So right from the beginning, the hospitals are designed digitally, and the interaction between systems are connected in a digital way, and with computerized modeling, both in the design and through the construction. But then you can see what typically happens up in the traditional way that hospitals are built. You know, the state, the Ministry of Health, or the local health system, or the local leaders of the hospital usually employ an architect that builds the concept, the beautiful facade, you know, beautiful new hospital, the nice areas, the nice workstations. They'll think about workflows. They'll think about the way things should be designed. They'll think about the placement of sinks, some patient safety things. But then when it comes down to the detailed stuff, like all of those intelligent systems, well, we'll just throw that over the wall to the mechanical, electrical, plumbing, IT designers who work in silos and do the same designs that they've done for the past 10 years, because if they have to do a new design, that's going to cost them money. It's much easier for me to take what I used to do and apply it to this same new hospital. And what they don't do is they don't work with each other. They don't have a history of crossing silos and connecting things together in an intelligent way. And then finally, and then only at the end, do they bring in the technology providers that, after it's already designed, build that hospital in it. When you're designing if you want to build a digital hospital and you want all these things to work together, because you're going to have all of those systems anyway. You know, if you spend 100 million euros, if you spend 900 million euros on a new hospital, you're going to have all of those systems anyway. But if you want them to talk to each other, you need to have that at the concept phase way up front. We heard earlier about getting active involvement of the different people in the hospital in the design. That's critical, of how they want it to be. And what's the concept of how they want it to be. And then map the technology on top of that to do what the hospital would like to do for this new concepts. And if you map that early, then all of these systems can be made to talk to each other in an intelligent way without additional costs into the project. If you try to do all that at the end, after a hospital is built, if you try to make a building like this really integrated, it's going to cost a lot of money, too late. So it needs to be done very early. The other part is, you know, when hospitals are built, there's always delays. I mean, this is CapEx now, I'm not talking about operational savings. And it happens because you have all of these intelligent systems coming and being put in the hospital in the last minute. Everyone tripping over each other, fighting for space in that new hospital building. And it can be done in a more efficient way to put things together as they come, and saving, in this case, in a UK hospital, we showed save a half €500,000 and saving 8 weeks of time. And that's because you have lots of different integrators with different project managers all coming in with all different designers with all their own silo of equipment that doesn't talk to each other, with their own project teams running into each other. And it can be done more efficiently if you streamline it in an integrated way, so that you start with the concept from the hospital staff, you start with the conceptual design, and all the way through to the execution, it's done in an integrated way. So, in summary, I wanted to show you a new hospital, which was Perth Children's Hospital, which we think is one of the most advanced in building a digital hospital for the intelligent infrastructure that goes around it. It's because in Australia, like in Finland, like in all most advanced health systems today, they're struggling with costs as a percentage of GDP, and that in order to bend the cost curve, we've got to make hospitals in a different way that will make people more productive. They'll help reduce costs, increase productivity, increase patient safety, and improve the patient experience. And so what we tried to show here was not only how they did it by connecting things together, but connecting it intimately with a healthcare IT system to bring the right information to the right person at the right time to make these improvements. Thank you very much.